For decades, cortisone was a go-to injection for chronic foot and heel pain. If you had plantar fasciitis, Achilles tendonitis, or stubborn joint pain, your doctor would reach for that familiar vial of steroid medication, but that's changing. And if you're someone who's been told you need repeated cortisone shots, or you've already had them and the relief keeps wearing off, this video is going to change everything you thought you knew about treating chronic foot pain. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas, where I've been helping patients overcome chronic foot and ankle pain for over 25 years. Today, I want to introduce you to something that's revolutionizing how we treat foot and ankle pain. It's called DPMX, and it might just make cortisone injections a thing of the past. Before we get started, please take a moment to like this video, hit the subscribe button, and share it with anyone who's been struggling with chronic foot pain. This information could change their life. Let's start with a quick refresher on what cortisone actually is, because understanding this will help you appreciate why DPMX is such a game changer. Cortisone is a powerful anti-inflammatory medication, essentially a synthetic version of a hormone in your body naturally produced. When we inject it into damaged tissue, it works fast, really fast. It reduces swelling, calms inflammation, and can provide dramatic pain relief, sometimes within hours. And I want to be clear, cortisone has been a valuable tool for decades. It helped millions of people get back on their feet. It's covered by insurance, and it's an easy in-office treatment. And when you're in severe pain, that rapid relief can feel like a miracle. But here's what we've learned over the years, and what many patients are starting to realize. Cortisone treats symptoms, not the actual injury. Think about it this way. If you have a leaky pipe in your house, cortisone's like putting a bucket under the leak. It catches the problem temporarily, but it doesn't fix the pipe. When you have plantar fasciitis, the plantar fascia, that thick band of tissue on the bottom of your foot, has tiny tears and chronic inflammation. Cortisone reduces that inflammation beautifully, but it doesn't help those tears heal. The underlying damage is still there. And here's what's even more concerning. Repeated cortisone injections can actually weaken the very tissues we're trying to help. Studies show that multiple steroid injections can increase the risk of plantar fascia rupture. That's why most doctors limit you to just 2 or 3 injections to an area per year. In my 25 years of practice, I've seen this pattern over and over again. A patient gets their first cortisone shot that feels amazing for 3 to 4 months. The second shot might last 6 to 8 weeks. By the third shot, they're lucky to get a month of relief. That's when patients start asking me, "Doc, what's next? Is surgery my only option?" And until recently, for many patients, the answer was often yes, but not anymore. Let me introduce you to DPMX, and this is where things get really exciting. DPMX is derived from Wharton's jelly, which is found in the umbilical cord tissue that's ethically donated after healthy births. Now, I know this might sound unusual at first, but stay with me, because the science behind this is remarkable. This tissue is incredibly rich in growth factors, cytokines, and extracellular matrix proteins, essentially all the building blocks your body needs to repair damaged tissue, not just mask the symptoms. Here's the fundamental difference. Cortisone suppresses your immune system and reduces inflammation, but DPMX actually supports and enhances your body's natural healing processes. Instead of putting a bucket under the leak, we're actually fixing the pipe. Think of DPMX as providing your damaged tissue with a complete toolkit for repair. It's got the growth factors for signal healing. It's the anti-inflammatory compounds to reduce pain naturally, and the structural proteins to help rebuild stronger, healthier tissue. Let me explain how DPMX actually works inside your body, because understanding this will help you see why it's so effective. When you have a chronic plantar fasciitis or Achilles tendonitis, it's like having a construction site where the workers have given up. The damage is there, but the repair process has stalled out. Your body's natural healing response just isn't strong enough to complete the job. DPM works through cellular communication. Those growth factors I mentioned, they're like sending a team of expert foremen to restart the construction project. They signal your damaged tissue to begin repair. They encourage the formation of new blood vessels to bring in nutrients, and they support the production of healthy collagen. Unlike cortisone, which shuts down the inflammatory process entirely, DPMX modulates inflammation. It reduces the harmful inflammatory pathways while preserving the beneficial ones that are necessary for healing. The result? Instead of temporary symptom relief, you get actual tissue regeneration. Instead of weakening the tissue, you're making it stronger. Instead of diminishing returns with repeated treatments, you're building on previous improvements. So what conditions can DPMX help with? In my practice, I've seen remarkable results with several chronic foot and ankle problems. Plantar fasciitis, especially the chronic cases that haven't responded to conventional treatment, Achilles tendonitis, particularly where there's degenerative changes in the tendon, capsulitis and forefoot pain, where the small joints and ligaments are inflamed, and arthritis. While we can't reverse severe joint damage, DPMX can often slow progression and improve joint function significantly. What I find most exciting is that DPMX often helps patients who've tried everything else. These are people who have done physical therapy, tried custom orthotics, have had multiple cortisone shots, or facing surgery as their only remaining option. Let me walk you through what to expect if you decide DPMX is right for you, because I know so many people are nervous about trying something new. The procedure itself is very similar to getting a cortisone injection. It's done right here in the office, usually takes under 20 minutes, and I often use ultrasound guidance to ensure precise placement of the DPMX. Now here's where DPMX differs significantly from cortisone. With cortisone, many patients feel relief within hours. With DPMX, you need to be patient. This is regenerative medicine. We're actually healing tissue, and that takes time. Most patients start noticing improvement around 4 to 6 weeks after treatment, with continued improvement over the following months. Some patients see benefits as early as 2 weeks. Others might need 8 to 10 weeks. But when the improvement comes, it tends to be more lasting because we've addressed the underlying problem. Now, some of you might be wondering about PRP, platelet-rich plasma, which is another regenerative treatment I offer. Let me explain the difference. PRP uses your own blood. We draw it, concentrate the platelets and growth factors, and inject them back into your damaged tissue. It's excellent, and I use it regularly. But DPMX has some unique advantages. First, it doesn't require drawing your blood, so it's perfect for patients on blood thinners who can safely have PRP. Second, DPMX contains a much richer variety of healing factors, not just growth factors, but also the extracellular matrix and structural proteins that provide scaffolding for the tissue repair. I often recommend DPMX for patients with more advanced tissue degeneration, diabetic patients whose own healing factors might not be as robust, or patients who have not responded adequately to PRP. Let me give you a direct comparison so you can see the difference. Cortisone offers quick pain relief, powerful anti-inflammatory effects, but temporary results. You might feel great for a few months, but you'll likely need repeated injections, and each one tends to be less effective. DPMX, slower onset, you need patience, but it encourages actual healing, addresses the root cause of your pain, and the improvements tend to be longer lasting because we've actually repaired the damaged tissue. Think of it this way. Cortisone is like taking a powerful painkiller for a broken bone. DPMX is actually setting the bone so it can heal properly. So who's a good candidate for DPMX? Let me help you figure out if this might be the right for you. If you're an ideal candidate, if you have chronic pain that's been going on for months, if you've tried conservative treatments without lasting success, if you want to avoid surgery or you're looking for a healing-based approach rather than just symptom management, DPMX is particularly valuable if you've already had multiple cortisone shots with diminishing returns. If you're diabetic and your natural healing is compromised, or you're on blood thinners and can't have PRP. DPMX might not be your best first choice if you have acute inflammation that needs rapid suppression, or if you're expecting immediate pain relief. This is regenerative medicine. It requires patience and commitment to the healing process. Let me address the questions I get most often about DPMX. First of all, is it safe? And the answer is absolutely. The tissue is thoroughly screened, processed in FDA-registered facilities, and sterilized. The safety profile is excellent. In fact, only 3% of donated umbilical cords qualify to be processed for DPMX. Is it covered by insurance? Currently, most insurance plans don't cover DPMX because it's considered regenerative medicine. It's typically a cash pay treatment. How long before you see results? Most patients notice improvement between 4 to 8 weeks with continued progress over several months. I know the cost can be a concern, but consider what you've already spent on treatments that only provided temporary relief. More importantly, consider the cost of continuing to live with chronic pain or the expense and recovery time of surgery. Here's what I want you to understand. We're living in an exciting time in medicine. For decades, we've been limited to treatments that are either mass symptoms or required major surgery. DPMX represents a fundamental shift in how we approach chronic foot pain. Instead of just managing your symptoms, we're helping your body heal itself. Instead of weakening tissues with repeated steroid injections, we're making them stronger. After 25 years in practice, I can tell you that regenerative medicine is changing everything. Patients who are facing surgery are avoiding it. People who have given up hope are getting their lives back. Thanks for watching this video. If you're struggling with chronic foot or heel pain, if cortisone shots aren't working like they used to, if you're tired of just managing symptoms instead of actually healing, there are options you might not know about. If what I shared today resonates with you, if you think DPMX might be the answer you've been looking for, I would encourage you to schedule a consultation. Call our office, mention this video, and we'll do a thorough evaluation, discuss whether DPMX is right for your specific situation, and create a treatment plan that's tailored to your needs. Please take a moment to like this video if it was helpful, subscribe to the channel so you won't miss another video about advanced foot care treatments, and share this with anyone who's been struggling with chronic foot pain. Remember, you don't have to live with chronic pain. There are solutions, and we're here to help you find them. Thanks so much for watching, and have a great day.